You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
You're listening to Bark and Wag's 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Jeff Werber. He's practiced veterinarian medicine for more than 30 years and is one of the select few actively practicing veterinarian medical journalists in the U.S. He serves on the advisory board of Veterinary Economics Magazine. Known to the world and his clients as Doc Hollywood, Dr. Werber has frequently appeared as an expert guest on Good Morning America, The Dr. Oz Show, Rachael Ray, Fox and Friends, Inside Edition, CBS The Early Show, CNN, and Fox News, among others. Dr. Werber is here today to discuss the importance of observing your animal's behaviors and how frequent or constant scratching, licking, biting, scooting, and or rubbing are most often signs of allergic skin disease. Welcome.
Hi there, Polly.
Thank you for being on the podcast today.
Oh, you're welcome.
I understand that you're an expert in itching, and we have a black lab that's always itching, especially in the summer and after swimming in the lake. So I look forward to finding out more tips.
So, when it comes to itching, dogs will itch and, scratch at any time. But the real question becomes, when is it a problem? When? How do you know that you should seek some assistance? And I always, try to teach people that when it becomes bothersome, when it interrupts their normal activity, whether it's eating or playing, when you hear that collar and the jingling because of the ID tags at the middle of the night because they're scratching, then chances are it's a problem. And it's not just scratching. You might see some dogs will rub against the carpet or a wall. Some dogs might be licking their feet or their groin area, scooting their behinds. I mean, all of these things could be related to allergies. And as you mentioned, this time of year, the problem is often heightened because when we think of the allergens, of course, we have pollens and grasses and trees and weeds, which are at a much higher tendency here during this time of year. But also there are environmental allergens. They're like food. And around the house, it's house dust mites, it's tobacco, it's wool, it's cotton. There are some dogs that actually will test positive to human skin. So, yes, you've heard of people allergic to dogs and allergic to cats. Well, there are some dogs that are allergic to people. So it really is important to know when the itch is more than just a little itch. So what I recommend, a couple of things. First of all, learn what their normal is, learn their body language. I said use your own instinct. And for that, we recommend people visit a great website called youranimalInstinct.com. And on this website, you'll have an opportunity to take the Itch Instinct quiz. Nothing you have to study for. It's basically simple yes or no answers. And it'll help determine whether or not the itching, the scratching, the rubbing, the chewing, the scooting that your dog may be doing should be of concern. And not only that, there's more that taking this quiz does. And I want to talk about a really great program. It's sponsored by Zoetis, and it is called the Canine Courage Program. And what the Canine Courage Program does, it triggers awards. So anytime someone completes the quiz, there is a donation triggered by Zoetis to the Canine Courage Program. And this program will provide healthcare assistance to retired police and military dogs, as well as to service dogs who are assisting veterans suffering from post-traumatic stress or traumatic brain injury, things like that.
Oh, that's wonderful.
So it's really a great program. In fact, right now, they're working along with American Humane, who has a program called From Shelter to Service. And basically the same type of thing. They are taking these shelter dogs and training them to be service dogs to help these veterans. So it's really a wonderful relationship where we are trying to help the dogs, help our veterans, at the same time provide some relief for the scratching, itching dogs. When you go on the website, you'll also learn about a fairly new medication that has become my favorite, because typically when dogs start to present with any problem, pet owners always say, I can fix this, I can do it. And they will go to the store, they will buy or do whatever they have, or they'll sometimes worse yet, go online. And sometimes that could be I have a great coffee mug that says, "Don't confuse my medical degree with your Google search." So, it's interesting that a lot of people will do this and will think, "Oh, I can handle this." And one of the medications that they will reach for are antihistamines. Because when we have antihistamines, when we have allergies, we shoot for the antihistamine. But the problem is that in dogs, histamine plays a very minor to maybe no role at all in the canine allergy. So to give an antihistamine, other than possibly causing a little mild sedation, it's not going to help the actual allergy. So a new medication out called Apoquel is hoping, where I'm seeing it, at least in my practice, almost replacing the corticosteroids and immunosuppressive agents that can be effective, but also have side effects, whether it's increased water drinking, which means increased urination, whether it's increased appetite, which means weight gain. It has effects on the liver. In the cases of immunosuppressive drugs, it could be other infections. So even though that was the best we had, they weren't great. And with the Apoquel, it's the first medication of its kind that will actually stop the canine itch at its core. It really attacks it. It's fantastic and very specific, so it doesn't have the slew of side effects, and very fast acting. We will see it start working within 2 hours or 3 hours of administration. So it's really fantastic. So, I see working with these dogs, working with the this time of year especially, even though allergies is year round, we have an opportunity to help our pets, help our four-legged friends, help rescue dogs from shelters, provide healthcare assistance to these dogs that are ultimately helping veterans. So when you look at it, it's just a win-win-win all the way around.
So the new medication, is that just for allergies, or is it if your dog has mites, or is it all encompassing for itching?
It's for any kind of itch related to an allergy. So if the itch is related to a mite or it's related to an infection, that still needs to be addressed. But whether it's food allergy, environmental allergies like the grasses, the weeds, the trees, whether it's something around the house, it is any type. There is a reaction leading to an itch. The Apoquel is going to be the drug of choice.
And how did you decide to specialize just in itching, or do you?
Oh, I don't. I mean, I'm a general practitioner, but
Okay.
I would say this time of year especially, the vast majority, 70 to 75% of dogs brought into a veterinary clinic during this time of year especially is because of skin problems. And you got to remember that unlike people who have usually respiratory symptoms when they have allergies, in dogs, it's all about skin. It's ears, it's feet, it's the groin, it's the lower back, the skin infection, all related to allergies.
Sure, we have a pug, and in the summer under the vet's direction, we have to put him on allergy medicine along with, anyway, so I'm used to going into the vet because they start itching and they won't stop, and then they start licking. So, and Benadryl, that's another one over the counter that we sometimes use to help with itching.
Right, and the Benadryl, just so you know, it really does not do much for the actual itch itself. However, what some owners find is that it just relaxes the dog a little bit, so they're a little less anxious, and they might let that little itch go. But as far as going to the core of the canine itch, it is of little value. And as I said, some of the other the medications that we've used for years, and again, don't get me wrong, they can be effective, but they're wrought with side effects and medications that you don't want to use long term. For example, corticosteroids are great short term, they work well, but there are side effects. You can't use them forever. So we're always looking for the better solution for our dogs, and Apoquel is that better solution.
And if you can you let everyone know about the website again, and is that where you can find out about Apoquel?
The Apoquel it's youranimalInstinct.com. You can learn about canine itch. You can better determine through taking the itch instinct quiz whether or not your dog's itch should be something to be concerned about. And again, by taking the quiz, that will trigger a donation to the Canine Courage Program from Zoetis. And of course, as I said, that's going to help retired military dogs, service dogs, police dogs, and current service dogs who are working with the wounded veterans. So with programs like this around, and the American Humane's Shelter to Service program, we're helping dogs, we're helping people, and we're helping everyone's dog because of the allergic dermatitis that we see this time of year. and all year.
And can you give our listeners any tips on what to bathe your dog in if they have itching along with going to the vet?
So again, there are many great products out there. There's some good like oatmeal shampoos and rinses, but I tell people there's something that they get a kick out of. But if you are stuck at home, you have that dog, you want to give it something, you are better off using a mild detergent, a dish detergent, than you are a baby shampoo. Because the pH of a dog is different. And so, of course, everyone thinks, oh, well, God, the most mild shampoo is a baby shampoo, which is for your baby. But for dogs, you're better off going for that green or blue dish soap to bathe your dog. But ultimately, you want to see your veterinarian because oftentimes there are secondary problems, whether it's seborrhea, which is either a very dry skin or a very oily skin, secondary skin infection. So there are sprays and shampoos more specific for those conditions. So it's great to bathe your dog in a pinch, but you want to see your vet for some medications and shampoos that are more specific to help your dog.
Well, thank you very much for being on the podcast today, and we look forward to having you back.
I would love to come back in the future, and we can talk about anything pets. Love it.
Well, that's terrific. And I will also post all of the information on our show notes. And we certainly appreciate all the tips, especially since I've had some listeners contact me on how to solve itching. So this is super.
Well, Polly, it was great being here, and I hope I was able to lend a hand to some of the pet parents, pet owners out there. And I know I have 5 dogs at home, so this is including 2 Labradors. So this has helped me as well.
Okay, well, thank you very much, and we look forward to having you back.
Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.